One of the common questions that we get here when people are about ready to have a knee replacement is what kind of exercises they can do to help make their recovery go a little bit better. So there's three things that we tell them to do. One, we want good strength. Two, we want good range of motion or movement of the knee. And three, we want them to go into surgery with what we call a quiet knee. And I'll explain all of these here in a minute. So for strength, three exercises that you can do is one is what we call a quad set, and that is basically just tightening this muscle and squeezing and tightening that muscle. When we do this exercise, you see, you kind of watch for that kneecap movement, and you want to get that muscle nice and tight. 10 of those is a good place to start. The second exercise is what we call a straight leg raise. And this one, it's best to lay down, bend up the other leg to take some stress off the knee or the back. Keep the leg straight as a board and lift it up off the bed and then back on down. Commonly, people will bend that knee and lift it. You want to keep that leg straight as a board, lift it up and back on down. And 10 of those is good to do as well. Now the last exercise for range of motion or movement is heel slides. This one here, bending up and sliding down. It's a little strengthening, but it's mostly getting that knee as flexible as possible before surgery. And the last exercise for the range of motion is the bike. So this exercise we recommend because it's a way to get the knee moving, but not a lot of weight on the knee joint. So for a lot of people it feels better than walking or some of those weight-bearing exercises. To make the airdyne go a little bit better, if you can raise that seat up high so that knee isn't bending too much, that might be a better place to start. As you can see, when I get my leg all the way down, my leg is still bent here, so I could raise this seat up another notch or two and still be able to get all the way around. And 10 minutes on the bike once a day is a good place to start as well. And the last point I talked about is going into surgery with a quiet knee. So quiet means we don't want as minimal pain and swelling. So if you, that week or two before, you try to avoid any activities that might be irritating or might swell that knee, if you can go into surgery with the knee feeling really good and strong and not real swollen, your chances of for a better outcome is a lot better.